So here to answer your questions about the virus is Dr. Hussam al-Soub. He's a consultant for infectious diseases at the Hamad Hospital. That's the main national medical centre here in Doha. Thank you very much for joining us. So I'm going to begin with a question I have here from Elias Haddad from Brussels. Now he says, are there any precautions, medical or otherwise, that my family and I can do to safeguard ourselves against H1N1? So, in other words, what can people do to protect themselves?
The first thing is, if you are planning to travel for an area that is involved with the disease, if that travel is not urgently needed or necessary, that's the thing you don't do. The other thing, if you, for example, know that a person who is infected or possibly infected with the virus, you should keep away from that person. Or if you have to have contact with that person, then you have to take certain precautions like wearing a mask, not to come very near to the person who is affected by the disease. Hand washing is very important if touching the patient himself or touching the surrounding of the patient, because we know that the virus is transmitted either by droplet from during sneezing or coughing, or by touching a surface that is infected with the virus. So these are simple measures that we can do. If you are, for example, the person who is infected, then you have to take also precautions not to expose as much as possible people to the virus. If you have the cough, then you have to use, when you are coughing, use some tissues. That tissue should be disposed so that it will not be touched by other people.
Yeah,
and keep
your
some contact.
Basic precautions there that we can take to try and protect ourselves. Shanaz from Doha asks, what is the difference between this and normal flu? Why does this flu kill you, or why does it have the potential to kill you? I mean, are there any indications that this is any easier to transmit or any more dangerous than the normal flu?
Yeah, this virus is very similar in a way clinically, I mean, in the presentation, like fever and cough, and very similar to the seasonal flu we encounter every year. The only danger about this virus is that it's a very new virus. So me and you and everybody is non-immune to that virus. So if I get the virus, my body does not have antibodies to fight the virus. So that's the main danger. So it's new for everybody. And
but just picking up on that question from Shahnaz, how different are the symptoms compared to ordinary flu?
No difference. You can't differentiate by the symptoms if you have H1N1 virus or if you have the seasonal flu. No way to differentiate except by doctors who to do the blood tests and the necessary investigations.
Dea Ajay from the United States asks, do we know yet what percentage of people actually die if they contract the disease? How deadly is it? I mean, that's a very good point, because there does seem to be some inconsistency in the effect of this virus on people, because while some victims have died, others have recovered after mild illness. Yeah,
fortunately, there have been only one death in the United States. No other deaths outside Mexico. In Mexico, they have reported the death rate of around 1 to 4%. So it's not a deadly virus. You know, just to remind you of the avian flu we had in the last few years, that the virus, which is the same flu, which is a flu virus, caused 60% death rate. So it's much less than that virus. So it's anyway very similar to seasonal flu. You know, seasonal flu, around 20 to 40,000 patients die every year in the United States.
Yeah, we were going to come to that a little later on. But I have a question here from Hamad in South Africa. Now, you touched on this issue about people who might be travelling, but he says that I'm booked to travel to Spain, Morocco, Portugal and France next week. Busy week for him. Please advise if I should travel to these countries. Will it be safe, and do I need to take vaccinations or medication before I leave? I mean, this is also part of the problem. The fact that this is a new strain means that there aren't any vaccines
to fight it.
The
advice here is that if that travel is necessary, then you have to go ahead and do it. If not, then you can probably postpone it. The other thing, if you are traveling, you have to take the simple precautions. Don't go to a very crowded area. If you know that a person that is having like what looks like flu, keep away from him. Maintain the hand washing practice, and if you are going into crowded area, you may use the masks. That are simple measures that are enough usually to protect you from getting the disease.
Now, Elsa Sarah Eva, she doesn't say where she's from, but she asks that, she says, is it true that regular masks currently available on the market only prevent us from spreading the virus to others around us, but do not prevent us from being infected by others?
You know, we know that the virus is transmitted by droplets, and usually these masks are enough to protect you. Of course, for healthcare workers, we are advising them to use more a new type of masks that called N95, which are more protective. So, but the usual masks in the market are usually protective to the general population.
Now, you were saying earlier that according to statistics in the United States, that the ordinary flu kills tens of thousands every year.
Yeah.
So we're going to try and look at the cold facts about this disease, try to put it all into some context for you. So far, H1N1 flu is confirmed to have killed 13 people. But in the same period, measles has killed 3,800 people, most of them children, even though a safe vaccine against measles exists. Malaria killed 19,000. It's a disease that's avoidable if mosquito nets and medicines are used. Tuberculosis killed 30,000 people, figure rising to 40,000 for people killed by HIV/AIDS. And let's take a look at those numbers in a different way. As you can see, flu accounted for a tiny proportion of deaths from the disease in the world in the last 7 days. So has the world overreacted to the threat from H1N1? I mean, flu deaths are common around the world, aren't they? Because the annual death toll from flu is estimated to be somewhere between 250 to 50,000 a year. 500,000, excuse me. That's according to WHO. So has the threat from this virus been somewhat exaggerated?
I don't think it was exaggerated. The problem in this virus is that we are not immune to it. I mean, for the seasonal influenza, we have some immunity in our bodies, but this virus, we don't have immunity. That's the main fear, actually, because we don't have immunity. There is a potential for the virus to spread all over the world, so this will lead to a pandemic. That's why we are very concerned about this virus, not for the seasonal influenza virus. Yes.
Is it only a matter of time then before it leads to a pandemic?
In the good news that, I mean, the number of cases are leveling off, and I was just listening to the Minister of Health in Mexico is telling that the numbers are actually coming down. So this is very delighting news, but we should be also keep ourselves on alert and prepared for any unexpected things that might happen in the future.
Okay, Dr. Hussam al-Soub, thank you very much
for
joining us.
Thank you.